So, ahoy! Thought it was about time that I did a follow-up. I think it's been about a year since my last update. A few things have happened. Obviously, I'm well back to work now, and obviously COVID has rather upset a lot of plans that everybody had. These things happen. Life is sent to test us. It's just unfortunate that it's testing us quite so hard at the moment. A few things. So I've had a few checkups, obviously, throughout the year. Every sort of 3 months or so, I've had a checkup with my ENT. I've also had checkups with my cardio team and also with my nephrologist. I don't see the oncologist at all anymore, so I'm completely handed back to ENT, who are now sort of managing me through until my discharge, which I think is in another few years now. So I had a bit of a breakthrough. The last 12 months have been a bit up and down for me. Certainly emotionally, I've been struggling. I'm not going to beat around the bush. I've been really struggling with coming to terms with what life is going to be like from now on. I still have a bit of a dry mouth, admittedly nowhere near as dry as it was 12 months ago, but it is still quite dry, and I still do have to drink quite a lot of water. And the problem with drinking water is that it flushes away anything that was there anyway. So trying to do that. I have put on some weight, which is good. Still not back to my pre-treatment weight, but that's not a bad thing, I would think. I've still got some numbness in my leg, and the taste comes and goes a bit. It's a bit difficult to tell. I think the particular tastes, like in particular sugar, is really, really difficult to tell. I had some custard the other day and realized, like 4 spoonfuls in, it just tasted like watery flour. I couldn't really taste it at all, and I had some actually last night and really couldn't taste that it was custard. I could smell that it was custard because I'm smelling my food before I eat it, but couldn't really taste it very well. And I think the mind sort of plays some tricks on you in a good way, in as much as it sort of, if you smell something or you know that something is custard, it kind of puts an impression over the top of when you're eating. You can feel that it's custard, and the motion in your mouth is that it's custard, and so it gives you that sensation. Although, on the realization, I really couldn't taste the sweetness. There's a few foods that are still like that. Tomato still tastes a bit weird, but I'm getting kind of used to it. It doesn't taste like it used to taste, but c'est la vie, we move on. Throughout all of the checkups that I've had with the ENT, what they tend to do is take an endoscope, or some sort of camera anyway, and they put it up my nose and then down through the back of my throat, and they're going to have a look at my tonsils and my neck. And every time they've done that, in fact, even before I was diagnosed with cancer, when they were doing it, they were saying, can't see anything, everything looks fine, it looks nice and normal. And now that we're post treatment and we're kind of on the lookout for a recurrence, it hasn't given me any sort of confidence that they couldn't see anything, because they couldn't see anything the first time around. So why would not being able to see anything this time around give me any comfort? And it was only really at the last session, so this was last week, so this is March now of 2021, that was the first time that they've really explained what has happened. So they keep saying that, oh yes, it looks nice and smooth and pink and all these things, and looks fine and it's flat. And they said, and that's fine. And I said, it doesn't help me at all to really come to terms with the fact, because before treatment you said exactly the same thing. And they said, oh no, Mr. Jenkin, things have changed. You don't have tonsils anymore. Now that might seem really basic, but no one has explained to me that I don't have tonsils anymore. No one said that. And so when they're saying it's smooth, what they're actually saying is they can't see a tumor that they would normally be able to see. So a tonsil is a kind of irregular organ. It doesn't have a normal texture to it. So you know, put your dinner down at the moment right now, because when he was feeling my tonsils before I had treatment, he couldn't feel a tumor. He couldn't feel any sort of irregularity in there, because tonsils are by their nature very irregular. And so now that I don't have a tonsil, if the cancer were to come back, it would be like a palm tree in a desert. It would stick out like a sore thumb. It would be very obvious that it was there. There would be no sort of ambiguity in the texture or the makeup of that that organ or that area of my throat. And so it's very easy to you know, visually identify that the cancer has not come back. There are no other symptoms or signs, well, other than the fact that my jaw still clicks and sort of dislocates and relocates itself very quickly. And I've got a little bit of tenderness in that area. It is very itchy, but itchy was always one of those symptoms that was both a positive and a negative, right? Because it means something's growing or something's healing or something's changing. And you're always concerned, well, does changing mean cancer? Or does changing mean it's healing and it's recovering from the therapy? So great news. It has really unlocked a great deal of pressure from me. I've found that in the last week my mood has changed quite considerably. I've you know, become a lot more positive, certainly about my cancer, and yeah, I've been sleeping a lot better than I have been previously. So super happy. Another thing that they didn't tell me, and I've only really found out in the last couple of weeks, having spoken to Dale and a couple of other people, is if the cancer ever did come back, and when we say ever, Dale was saying, you know, probably within a 20-year period, they would probably not give me radiotherapy. So why is that? Well, when they give you radiotherapy, they give you that 6-week sort of program of therapies. That is your full lifetime dose of radiation to that area of your body. Any more than that, and there is a significant enough risk to your body and your life that they would not want to give you any more. So if I were to get, you know, cancer of the fingertip or something like that, absolutely, you know, if radiotherapy was the right thing to do, then they would, you know, expose my fingertip to radiotherapy treatments. But if I ever had a recurrence of throat cancer again, they would not opt, or very likely would not opt, to give me radiotherapy. They would either go through surgery and or chemotherapy in preference. That was a real shock to me, because I always thought, you know, when I've seen other people have cancer and then it's come back, I've always thought, goodness, they're going to have to go through that radiotherapy again. And actually, generally speaking, if it were in the same area of the body, then they won't give, or certainly, sorry, I should say head and neck cancer. I don't know about other areas of the body, and I'm obviously not a clinician, but they wouldn't give you radiotherapy to the same area of the body, because they've already given you your lifetime's amount of radiation to those organs. And they would then, you know, only in sort of 20 years time, if I was in my 60s or so, that they would then reevaluate and go, well, time has passed, fairly old now, is there a significant enough benefit in giving radiotherapy as opposed to other treatments that might be available? So that was a real eye-opener as well for me. The thought of going through radiotherapy again does not fill me with wonderful, warm, soggy, moppy, fuzzy feelings. Anybody that goes through radiotherapy and chemotherapy, and obviously in particular the head and neck varieties, I have the utmost respect for. It was awful when I look back on it. I'm so pleased to be the other side. I'm so pleased to have had a positive outcome. So many people don't have good outcomes of their radio or chemotherapy. I feel very I'm totally in respect of all of the professionals that provided me with the support that I needed, the therapies that I needed, the attention that I needed, and I'll do anything I can to support any other people that are going through the same thing. So if you are going through head and neck cancer treatment, or someone has suggested that head and neck cancer treatment is something that you're going to need, please do watch through my videos. Hopefully you'll see the low points and the high points. I tried to do a no holds barred account of my treatment. I am now only 18 months post therapy. There is still 18 months past gives me sort of 20% likelihood of recurrence now, so it is still there. There is still the threat of cancer coming back, but it is significantly reduced, and it is being managed and monitored. So I've got another 18 months. Honestly, I'm not very sure, but I would imagine that even if it popped up sort of after that period, that the clinicians would give me the care and attention that they were able to this time around as well. Anyway, enough of me drivelling on. I am here at Ipswich Hospital again, which is why it reminded me that maybe it's an opportunity to give an update. I'm here at Ipswich Hospital, here for my second COVID jab. I am the only person I know, like first person account here, of anybody that I know that has had their second jab. I'm having the Pfizer jab because of risks around the AstraZeneca jab. I don't react particularly well to things like the flu vaccine, and so it was decided that the Pfizer vaccine was a much safer bet for me. And so we've got, lots of controls have been taken place to monitor and manage my exposure to any of that risk. So I'm here for my second Pfizer vaccine jab this morning. Again, super impressive referral process that was in place for me, yeah, sore arm and gonna feel pretty crummy tomorrow, but in light of what it could do to me, I'm super happy to be accepting it today. And if you get the option of having the vaccine, obviously please take it. Having a small couple of days of feeling a bit rubbish is by far and away better than the alternatives. Anyway, if you are out and about, please do stay safe and do try to remain indoors, and all the other things that the government and health professionals are telling us to do. It is important. And yeah, be well. I don't know when I'm going to have another update. It might be in another year's time, it might be sooner, who knows if anything changes. But be well, everyone. Toodaloo. Bye.